Alzheimer's dementia affects 1 in 6 adults between 75 and 84. Current medications for Alzheimer's disease can help with symptoms like memory, attention, and ability to complete everyday tasks. The problem, however, is that medication cannot prevent someone without symptoms from developing Alzheimer's disease, nor can medication prevent Alzheimer's disease from progressing to later stages. There are a few key stages of Alzheimer's disease. First is mild cognitive impairment, where somebody's memory or other cognitive abilities become worse. About 1 in 3 people with mild cognitive impairment will go on to develop mild Alzheimer's disease. This eventually progresses to advanced Alzheimer's disease. Alzheimer's disease is normally diagnosed in these later stages. However, at these later stages, Alzheimer's disease has already caused irreversible brain changes. Our best chance at preventing Alzheimer's disease is creating a medication that will work at the earliest stages. To create this medication, we need to enroll people into clinical trials. Right now, enrolling someone into a dementia clinical trial is a very expensive, invasive, and time-consuming process. For example, to be enrolled in a clinical trial, a person may have to go through doctor's appointments, family interviews, cognitive testing, spinal taps, blood testing, brain scanning, and genetic testing. In the CANARY study, we want to develop a new way to select people for clinical trials. We want it to be cost-effective, non-invasive, efficient, and most importantly, it needs to be able to identify individuals as early as possible. Previous studies have showed that a person's speech can change at the earliest stages of mild cognitive impairment. As well, an individual's eye movements can also change as Alzheimer's disease progresses. In our study, we are looking at how both speech and eye movements can change over time. By recruiting healthy volunteers, people with mild cognitive impairment, and people with Alzheimer's disease, we can track how eye movements and speech change over time and find patterns of speech and eye movement changes to help select people for clinical trials. The lives of people with Alzheimer's disease and their caregivers will significantly improve if we can develop a medication that will prevent Alzheimer's disease from getting worse, or if we can prevent Alzheimer's disease from happening in the first place.